Hi everyone. It's good to connect, even if it is virtually and online. But I've been connecting with most of you one-on-one a little bit, whether it's text or messaging or Facebook or something like that. So happy to hear from everybody. Please let me know how you're doing if you haven't reached out in a while. I'm going to do the chapters in segments. It's too long to do a whole hour recording. Nobody wants to watch an hour-long video. I don't want to talk for an hour. So I'm going to do like 15-minute chunks. That way it's easy, manageable. You know, when the kids are in bed or, you're not totally swamped and busy, watch a little segment piece by piece and we'll wrap up the last two chapters and the last two assignments for psych. We're in great shape. Regardless, you've passed this course, but we want to do it justice and get your full points and not just a pass. So I'm going to talk today about psychological disorders, which is all of chapter 13, and then in chapter 14 we'll talk about how those disorders are treated. I've already introduced you a couple of times to the DSM-5, and that was our discussion post there, where you all researched what it is so that you have a basic understanding. So we're going to talk a little bit about psych disorders and their prevalence, the symptomology, as well as the explanation and some of the causes behind what we know are some causes and explanations behind psychological disorders. Then we'll get into specific ones. I won't do them all because you're each doing one on your own that you're going to present to the rest of us. But I'm trying to cover the ones that you aren't intending to do. Schizophrenia being one of them, borderline personality disorder. I'll talk a wee bit about autism and ADHD. Don't think anyone chose OCD. I'll touch on that. Somatoform disorders, dissociative identity disorders, what we think of as multiple personality or split. Those will all be discussed. In general terms, nothing in depth. I did post some links to some credible psych websites where you can find out more information about kind of the symptomology, the prevalence, the explanation and origin of where the disorder comes from, as well as how it's treated and what some of the characteristics look like. So if you start with the chapter, it opens with a case about seasonal affective disorder. And I don't know if you've ever heard of that before or not, but it's kind of common in Canada. They say that it ranges from about 3 to 15% of the population suffer from basically a seasonal sort of depression, that in the darker months, the winter months, there's a pattern of depression that is expressed. In more severe symptomology with the 3% of Canadians where they are, moody, depressed, anxious, irritable, don't want to get out of bed, often hungry and have cravings and need a lot of carbs and sugar, struggle to cope with daily hassles and life stressors, have challenges in their relationships, kind of an overall dysfunctional criteria. So that's the more severe, and then there's milder forms that are sort of less effective. We don't know a lot about it, but we certainly know that all disorders have a root in a combination between my DNA, my genetics, and the environment I grow up in, whether that is the physical environment, the kind of family, the kind of community, the kind of toxins and things that you eat and are exposed to, air, water, all of that is a huge culmination of things. That whole nature-nurture debate, was I born that way and genetically predisposed, or was it my environment, the way I was raised, whether or not my mother did drugs while she was pregnant, or whether or not I was doing drugs when I was a young teenager and have caused anomalies in my brain, communities I lived in, higher toxin levels, like what causes these things? And the answer is nobody really knows. Nobody truly can say definitively A causes B. And you guys know that. Correlation, there's a correlation here between these two things. These two things are related, or there's a connection, versus A causes B, and that's almost impossible to discern. But we do know that there's a combination between what we consider genetic vulnerability. So I was born with something that's got a predisposition genetically, hereditarily, something, and a mix in my environment that causes this. So I'll explain more as we go. So what is a psychological disorder? Well, the thing is it's any behavior that we would say is not normal, not typical. you'll hear lots of terminology. Atypical means not typical. That causes some impairment in your daily life functions, some emotional distress. There's a criteria in your textbook that I think is really good. It's also how the DSM is done. And that is basically to ask yourself, is the behavior unusual, uncommon? Is it rare and what we would call statistically deviant from the normal population? I hate the word normal, but you know what I mean. Is it a faulty perception or a interpretation of your environment? Faulty meaning, am I maybe projecting or seeing things that aren't there? Is it an appropriate emotional response that I have to situations, or is it highly escalated, highly moody, or absolutely no affect? When I say no affect, I mean you don't respond to a normal situation in a typical way. You'll often see people with schizophrenia laugh inappropriately at situations that are not funny, or be extremely solemn and disconnected and almost like, what? No response when, there should be distress or crying or reaction. Is this dysfunctional? Does it impact my life in a negative way, causing dysfunction or distress, impairing my happiness or my daily life in a chronic way over time? Is my behavior possibly dangerous or socially unacceptable, not within the norm of everybody else in society? And you've got to keep that cultural perspective too, that like for what it is to be typical in a certain context versus what might be typical in China or typical somewhere else. We don't eat rats here or bats, but they do in other countries that would not be considered a psychological disorder. It would be considered typical behavior there. Is it a disorder that is causing you to be, incoherent, hallucinating, having delusions, beliefs that you're being victimized or persecuted, like you're not seeing things through a correct lens, it's more of a distorted lens. That's the flat affect I talked about, the dysfunctional, the dangerous, or socially unacceptable behavior. So those things, if you answer yes to a lot of those questions or checklist, chances are it's a disorder. And we know that disorders and psychological conditions are classified and categorized in a system known as the Diagnostic and Statistical Manual of Mental Health Disorders, the DSM, 5th edition. It's kind of what's widely known in North America, put out by APA, American Psychological Association, but also used by the Canadian Psychological Association for all psychological and psychiatric disorders. That's what it looks like. It's a great big heavy manual. You guys know it operates much like a checklist. Do you meet these criteria? Do you have these symptomologies at this often time over a chronic period? And that will often constitute a diagnosis. It is criticized as not being 100% credible and accurate all the time, and one of the reasons is not necessarily the book itself or the classifications themselves, but remember, it's left to interpretation. As a clinician, what I look for, what I identify as your disorders and your behaviors and your characteristics and your symptoms, and then I go looking in the book for the appropriate diagnosis and checklist. Every psychologist might approach it differently. So it's not that the book necessarily is not a good system, but it's left to interpretation and how it's used sometimes. About half of our population at some point in our lives, from childhood onward, may end up having a diagnosis of some sort. So isn't it strange that with such a high prevalence that we are still so stigmatized about mental health, and like nobody wants to talk about it, or they make it sound like that's craziness, even though it's so prevalent. These are some of the most common disorders in Canada that affect men and women differently. Obviously, the depressive and anxious disorders are up there, as well as PTSD. Psychosis or schizophrenia, one of the more rare ones, affects 1% or lower of the overall Canadian population. So it's more rare. So I only have about 5 more minutes that I want to wrap up. So I'm just going to talk about 2 specific diagnoses. And my kids are yelling in the background. Neurodevelopmental disorders, which are really childhood-related disorders. 2 of the most common are autism spectrum disorder and attention deficit disorder or attention deficit hyperactivity disorders. They impact children across the lifespan. Normally from an early age. Autism as young as 2 you can get a diagnosis, as well as ADD. So for autism, the 2 main characteristics for a diagnosis according to the DSM is that it impairs your social functioning, your relationships and your interactions with other humans, your eye contact, and your communication skills, your play behaviors with other children and adults, and the way you interact and talk with adults. We normally see it very young, and it will affect multiple aspects of a child's life, developmentally, as well as intellectually. And it's also it's becoming more common in terms of diagnoses. I would say this 1% of the population is not an accurate stat for today, 2020. And then hyperactivity disorder, ADHD, often diagnosed in that sort of first 7 years of life, affects more of the population. Some children will be diagnosed early in life, and then people will say that they sort of grew out of it as they got older. That I've seen happen too. But it's characterized mostly by your lack of attention, your lack of focus, and then heightened arousal level, stimulation level, more impulsive actions, not really paying attention to consequences, busyness. I've had kids that I've worked with who literally felt like they were vibrating sometimes. They were so hyper and had a hard time focusing. So those are known as neurodevelopmental disorders. Causes, again, back to causation. I don't think anyone can say for sure what causes it. There's certainly lots of possible explanations and possible hypotheses, but nothing definitive. There's been everything from what happened in pregnancy to genetics to whether or not immunizations caused ASD. And the reason it's called ASD is autism spectrum disorder. The psychological disorders can range, and I've told you about this before too, on a spectrum from severe to needing a lot of support and assistance to more mild and needing some intervention but minimal. And I've worked with families and children who can live on their own and fully function and become PhDs and become professors, and all the way down to degenerative brain disease and complete delay, mental retardation, essentially. So we know some things about ADD, although not completely definitively. We know genetics plays a factor in terms of like if your dad or someone in your family had it, there's a higher percentage you will inherit it. They have done brain scans, and they know that the frontal lobe is sometimes smaller in those images. Really, really hard to know. Some research has said smoking has caused that. Hard to know. Last but not least, I'm going to just wrap up talking briefly about schizophrenia, one of the psychiatric disorders that is more rare and is characterized by delusions, hallucinations, and speech and motor issues often. You'll hear people with schizophrenia talk and mutter to themselves and not always sound coherent. They often have a very unusual affect, which I described earlier as being not the right response to the social situation, unusual reactions to things. The paranoid schizophrenics often have delusions that the police are out to get them, the government's got bad intentions for them, but they also have delusions of grandeur, which means they might believe they're Jesus, or they might believe they can fly, and they get these sort of inflated personalities and beliefs about themselves. So the delusions can be either of those. It'll affect a variety of your life and your characteristics of your personality, your daily functioning, your mood, your attention span, how you perceive, all of those things. And there's a biopsychosocial perspective of why we think schizophrenia occurs. We know it can occur early in life, as early as 7. Most often it comes out around the age of 20. I'm not going to have time to get into all of the explanations for schizophrenia today, but I want you to look at the biopsychosocial perspective, all the possible reasonings for that, and I'll pick up here where I left off when I start the next segment. That's all for today. Hope everyone's well. Take care.